Welcome to today's webinar brought to you by OraSure Technologies Incorporated. OraSure Technologies is a global leader in oral fluid substance abuse testing products. Their unique assays provide accurate and easy-to-administer testing methods to help determine the presence or absence of drugs or alcohol in a person's system. Oral fluid-based testing products provide a simplified collection process, faster results, cost savings with minimal risk of tampering, and dramatically reduce risk of adulteration. The Intercept Oral Fluid Test is an FDA-cleared laboratory-based oral fluid drug testing system that enables accurate testing for drugs of abuse, including marijuana, cocaine, PCP, amphetamines, and opiates. With a fast and easy-to-administer collection process, Intercept is ideal for workplace, criminal justice, drug treatment centers, and clinical settings screening programs, among others. Today's presentation is entitled Dispelling the Common Myths of Oral Fluid Drug Testing and will be presented by Bill Current and Dan Mayers. Bill Current is the president and founder of WFC & Associates, a national consulting firm that specializes in drug testing policy development and providing accurate and up-to-date drug testing law information. He is the editor of the online Ultimate Guide to State Drug Testing at statedrugtestinglaws.com and the publisher of the e-newsletter State Drug Testing Laws Monthly and the weekly e-news service Drug Testing in the News. He is the author or co-author of 10 books on substance abuse issues, including Why Drug Testing. He also administers the annual Drug Testing Industry Survey, now in its 15th year. Dan Mayer has been in the background check industry for 12 years and serves as the Vice President of Sales and Customer Service for InfoCubic. InfoCubic's foundation was built on providing world-class customer service, industry-leading turnaround times, and accurate search results. Today, InfoCubic's commitment to excellence has allowed them to become one of the world's premier wholesale and retail employment screening companies, with clients ranging from small local business owners to global Fortune 500 companies. InfoCubic is a member of the National Association of Professional Background Screeners, NAPBS, and is ISO certified, which Dan will discuss later in today's presentation. Dan's knowledge of all things employment screening is why he's a vital member of the InfoCubic team. Today's presentation is approved for 1 credit hour of continuing education for CSAPAs, CDAPAs, and QSAPs from SAPAC. Further information will be provided at the end of our presentation. It will now be our pleasure to hear from Bill and Dan.
Well, thank you very much, Jessica. And as always, it's a pleasure to be doing another webinar with OraSure Technologies. I'd like to express appreciation to OraSure for hosting these monthly webinars, and also let the audience know that the next webinar will be OraSure will be hosting will be on June 25th. And all those who are on today's call will obviously receive information about that, as well as a SAPA webinar on the 11th, which will also be sponsored by OraSure Technologies. So OraSure very active in the effort to educate the industry on things related to trends and developments in drug testing, and more specifically oral fluid testing. So thanks to OraSure for that. I think just as a kind of a start, some basic things that most people in the drug testing industry certainly, and companies and other organizations that conduct drug testing, I think would all agree on, is that drug testing works. It's a powerful deterrent to drug abuse in the workplace, and it's a great and powerful way an effective way to identify people who need help. It works on lots of different cost factors, whether we're talking about safety and all the things related to safety like accidents, workers' compensation claims, use of healthcare benefits, etc., or whether it's lost productivity through tardiness and absenteeism and other things like employee theft and workplace violence. Drug testing has proven to be a powerful tool in addressing these cost issues. And while drug testing costs money itself, the savings that can be traced to drug testing is always significant. And whenever you look at the return on investment from drug testing, it's always right there on the mark. The cost savings ratio, and every type of ROI formula that I've ever put together, trying to be as as detailed as possible, always shows a significant and healthy return on investment in the employer's favor when doing drug testing. There are lots of different ways to do drug testing. For many years, the standard lab-based urine test was all that employers really had. And that, of course, has changed over the last 10 to 20 years. 20 years, if you go back 20 years to sort of the advent of the instant testing devices, the point-of-collection testing devices, commonly referred to as POCT testing nowadays, and going back about 10 years to the advent of lab-based oral fluid testing. There are lots of options out there to this standard traditional lab-based urine test that I'm showing on this particular slide, which involves, collecting the specimen and everything that's part of that process, transporting it to a laboratory, conducting that preliminary screen to see if one of the assays being tested for is positive, and then if that screen is non-negative, then having it confirmed by the laboratory, usually with gas chromatography, mass spectrometry, GCMS, and then having that positive result, which has been confirmed with this greater technology, having it verified by a medical review officer so that the report or the result is accurate and can be reported to the employer with a great sense of confidence that the result is in fact accurate. Well, today there are lots of different options that are available to employers, and lab-based oral fluid testing is growing in popularity for a number of reasons. Obviously, it's not urine. And while urine continues to be the number one drug testing method and is the market share leader, it just doesn't fit all needs. Whether we're talking about lab-based urine testing or instant urine testing, there are just some workplace situations where urine testing doesn't fit perfectly with the needs of the employer. And so that's one thing right there. One of the big things is that lab-based oral fluid testing is near to impossible to cheat on. I say virtually impossible just to be safe, because maybe there's something out there that people are doing to cheat on oral fluid testing, but it's really not very widespread or well known if it is out there. It reduces the time that it takes to conduct a drug test, and that's important because it's not just the cost of the drug test that we're concerned about, but it's the other costs that are involved in conducting drug testing that are important to take into consideration when you look at the actual cost of a drug test. And when we're talking about lab-based oral fluid testing, and the technology has come so far that we're really looking at an accuracy level with lab-based oral fluid testing that is in every way the equal to lab-based urine testing. And so apples to apples, not exactly, right, because we're talking about two very different specimens, but certainly on par with one another in terms of the accuracy when we talk about lab-based oral fluid testing and lab-based urine testing. Now, there's a lot of interest in the drug testing industry about oral fluid testing right now, in large part because the federal government, the Substance Abuse and Mental Health Services Administration, SAMHSA, has been in the process now of putting together the first draft of regulations to eventually permit lab-based oral fluid testing to be added to the federal regulations for drug testing. This is a huge, huge development and something that's been in the works for some time now, probably will still be in the works for a year or two going forward. But even though those federal regulations are not going to be out for a couple of years, let's say, on the outside possibility, it's still generating a lot of interest in the drug testing industry because now we know they're coming. And so every year, WFC and Associates, my company, conducts a survey of drug testing providers to identify the trends, to identify the things that are working, the things that aren't working out there in the drug testing industry, and then we present them every year at the SAPA conference. And for the last several years, OraSure Technologies has been one of our corporate sponsors, so we're grateful for that. These are just some of the comments that are indicative of what we're hearing from people in the industry as it relates to lab-based oral fluid testing. And I make the distinction right now that I'm talking about lab-based oral fluid testing because the federal government, SAMHSA, is not looking at adding instant or POCT oral fluid testing to the regulations, only lab-based oral fluid testing at this time. But these comments right here, quote, I am seeing an increase in oral fluid testing but not hair testing. We're seeing more interest in oral fluid testing because it addresses collection issues, etc. We're seeing more combinations of oral fluid for post-accident and urine for pre-employment. Big issue right there. And a couple of months ago, I did a webinar presentation for OraSure where we combined with Omega Laboratories, which provides not just hair testing but oral fluid testing as well, but to do a presentation on merging together two different testing technologies into the same program. And so that was on hair and oral fluid, but we're seeing oral fluid and urine testing programs being merged together as well, taking advantage of what's really strong about one testing technology and combining it with the strong advantages and pros of another testing technology. And so that's a combination, and that's a movement, a trend in the industry that we're starting to see more of. So a lot of interest in the industry as it relates to oral fluid testing, and a lot of buzz, a lot of talk about oral fluid testing. We're just about now, just a week or two away from launching our 2013 industry survey, which will be our 15th annual survey. And obviously oral fluid testing, hair testing, alternative testing methods will be a big part of the survey questionnaire. I suspect that we're going to see even more buzz about oral fluid testing in this year's survey because we're yet one more year closer to the reality of the federal regulations being expanded to allow lab-based oral fluid testing. So continued interest, only growing and getting greater. Now, we're going to spend a little bit of time talking about the common myths of oral fluid testing and adding some element of truth to it, if I could put it that way. There's a lot of misinformation that's still out there. And when I think about oral fluid testing, I really sort of drill down to three basic questions. Is it accurate? Is it legal? And is it practical? Will it work for my company? In our situation, with our kinds of work sites, with our type of the industry that we're in, will it work for us? And so as you consider lab-based oral fluid testing, either for your company or for the clients that you sell drug testing to, I think it comes down to these three questions: accuracy, legality, and practicality. And we're going to talk about those, all three of those questions, and answer all three of those questions as we go through some of the common myths that surround oral fluid testing. Now, I've been in the drug testing business for nearly 25 years now, and I've seen, just about every type of program that's out there probably. Lab-based oral fluid testing has been around for a while, but it started to become popular about 10, 11, 12 years ago. And, of course, as I said, it's really picking up momentum now. But there have always been certain misconceptions or myths about oral fluid testing that just seem to keep lingering on and on. And I think there's a big movement in the industry now to start to dispel those myths and those misconceptions, which is a good thing, because you have to understand that if these things were true, these myths that I've got here up on this slide right now, if these were actually true, then the federal government would not be going through the time and the enormous expense to develop regulations for lab-based oral fluid testing. It just simply would not happen. And perhaps that's the reason why the regulations have not changed all that much in the last 25 years, is because there were in the old days things that surrounded these testing technologies that were cause for concern, even with lab-based urine testing back in the 1980s for certain. But a lot of this information just continues to linger even though there's no truthfulness to it. And so we're going to go through each one of them. And I want to start with accuracy, because that's really the bottom line when it comes to drug testing. Is it accurate? Will it work? The results of oral fluid testing have, the way I worded it, have greater relevance to understanding the effects of drug abuse and assessing an individual's behavior, job performance, safety, risk, etc., than the results from urine testing. Now, that's not my wording. That's Ed Cohn's wording from you can see the citation for the results from a study that he did some years ago, back in 2006. The bottom line here is that it's not really a question of whether urine testing is better than oral fluid testing or oral fluid testing is better than urine testing. I think they're both good. The question is, which one's right for you? Is this testing method, oral fluid testing, does it fit with your company's circumstances and needs? If lab-based urine testing and lab-based oral fluid testing are essentially, the same in terms of accuracy, then the question is, which one works best for you? Oral fluid can be described as a blood equivalent. Now, there are some people who are a lot smarter than myself in our industry, the scientific people, who will tell you that blood is the gold standard of detecting drugs in a person's system. But we don't do a lot of blood drug testing, okay, for obvious reasons. Oral fluid mimics blood from a scientific standpoint in terms of detecting levels of drugs in a person's system. With an oral fluid test, you can detect both the parent drug as well as the metabolite, which is a big plus. And we're to the point now where we can actually quantify test results with oral fluid testing, which is also a big development. Now, there's some things that you can do to verify what I've just said. Go look for the independent empirical data that's out there. The things that have been published about oral fluid testing that come from independent sources. I think all the manufacturers of oral fluid testing, of course, OraSure is hosting today's webinar. That's important, and those are great sources, but go beyond that. Go to the empirical data that's out there and put these claims of accuracy to the test according to what the independent researchers have found. I think you'll find that lab-based oral fluid testing meets that test. I'd also look for FDA-cleared collection devices as well as lab-based testing processes. In other words, it's not just the collector that needs to be FDA cleared, but also the assays in the laboratory need to be FDA cleared. You may be testing for 12 different drugs, but are all of those 12 different assays FDA cleared? That's an important question to ask of any testing method that you're using. And I think those 2 points, independent empirical data and FDA-cleared collection devices as well as testing system in the laboratory, are the 2 most important points. Yes, look for referrals of satisfied customers in your industry. Do your own research. Put the package insert to the test. Obviously, know who you're doing business with. But it really comes down to what have the independent experts found, and am I using or am I looking at using an FDA-cleared device? Those things will tell you the story when it comes to the integrity of the testing device and the process that you're going to be dealing with. Now, one of the myths that just lingers and lingers is the window of detection. And many people are under the assumption that the window of detection with lab-based oral fluid testing is too short. And so my response to that is, well, too short compared to what? I'm going to show you a slide that compares blood, oral fluid, urine, and hair in a second. But the thing that you want to know is, what are we trying to detect, and what window of detection is going to be most effective at testing that? Oral fluid testing, if you look at from the beginning point to the end point, does have a shorter window of detection than urine testing, but urine testing starting point will be a little bit later, and hair testing starting point will be much, much later. And so if we're looking over a comparable period of time in terms of window of detection, oral fluid and urine are going to be very comparable. There's not going to be a lot of difference. In fact, in some reports, the positivity levels are actually higher with oral fluid testing compared to urine testing for a comparable time period. Okay, so let's look at that chart that I referred to. Here's the window of detection for 4 different testing specimens: blood, oral fluid, urine, and hair. I want to point out that at the far left of this chart is when the window of detection starts. And so you can see that the blue line and the red line, which are oral fluid and blood, are right on top of each other on the far left of the chart. That means that, as I said earlier, oral fluid mimics blood in terms of its ability to detect drugs in a person's system and when that window of detection starts. And you can see that it's not exactly on that far left black line, but it's right up against it, meaning that the ingestion of the drugs in the person's system are detectable in an oral fluid sample almost immediately after the person has ingested the drugs. The urine line, the yellow line, is a little bit farther over to the right. We're talking about, within an hour, okay? Not as immediate as oral fluid, but within a very short period of time, that window of detection opens up with urine testing. Hair testing is going to be much, much farther over to the right. The window of detection will start somewhere around a week after ingestion. That may not be an issue if we're talking about a chronic drug user, of course. They're going to have drugs in their system, in their hair all the time. But if you're looking for a window of detection that starts immediately after ingestion, because you're looking at say, a reasonable suspicion or a for-cause type of testing scenario. Somebody comes back from their lunch break and they smell like marijuana, then you're going to want to look at an oral fluid test, because that window of detection starts almost immediately, within minutes after ingestion of the drug. If you're looking for a broader window, you want to look at 3 to 4 days of a window of detection, then urine is going to be urine or oral fluid would be the testing methods that you'd want to consider. If you want a much, much broader window of detection, and you're not quite as concerned as when that window of detection opens up, but you want to go 90 days back into somebody's history to look at their lifestyle, then hair testing is the method for you. Now, there are a lot of studies out there, and again, I refer you to the independent empirical data that's available that shows that oral fluid will pick up drug use early on that urine will miss, and urine will pick up some positive results longer in that window of detection that oral fluid would miss. But on balance, if the cutoff levels are pretty much the same, even though they're measured differently, you're going to get very similar results. Now, here's a study that was done some time ago that compares positivity rates using the Intercept oral fluid device, and which is a lab-based testing system, of course, and urinalysis. And you see that the overall positivity rate higher with urinalysis than oral fluid, but very, very close. Go down to the fourth line of drug names, THC. That's obviously the psychoactive ingredient that's in marijuana. And you're going to see that the positivity rate was slightly higher with oral fluid than it was with urine. Interesting, because, of course, one of the misconceptions about oral fluid testing is that it has trouble detecting THC. Well, we know that that's not necessarily the case, because from the study that we just looked at, there's a lot of evidence out there that shows that oral fluid is a very reliable and accurate specimen for detecting THC. But there's a little bit more to it than just that blanket statement. A lot of it depends on the cutoff levels that are being used. That will have a huge impact on marijuana. And the testing method. There's a big difference between lab-based oral fluid testing and POCT oral fluid testing. Again, that's not to say that one's necessarily better than the other. It depends on what your needs are. But if this is a concern to you, you need to be aware of some of the data that's out there that compares the positivity rates for oral fluid testing via POCT devices or via the laboratory. Now, this is a chart that shows positivity rates at various cutoff levels, and right, not to the middle of this bar graph, but a little over to the left of center, you see a dotted redded line going up and down. That's the 50 nanogram point, okay, 50 nanogram per milliliter cutoff level. If you're talking about using a device or even a laboratory testing system, but more commonly you're going to hear that with a POCT device, that detects THC at 50 nanograms, then you can see that the positivity levels, which are all those blue bar graphs to the right, there's just not that many of them. The real positivity levels that you're going to be pleased with are the ones that are shown to the left at the much, much shorter, smaller cutoff levels. So if we're talking about 10 nanograms, you can see that top blue bar there. Even 15, even 20, even 25. But you get a little bit above 25, 30 nanograms per milliliter, and the cutoff levels the positivity rates start to drop significantly. And that's an important question to ask if you're looking at oral fluid testing. What is the cutoff level for THC? That's how you answer the question about whether or not the testing method that you're looking at using is going to be able to detect THC or not. The secret is in the cutoff levels. Now, one of the big advantages to oral fluid testing, whether we're talking about lab-based or POCT, is the fact that it's very, very difficult to cheat on an oral fluid test. It's just almost impossible. Now, I was given a presentation at the DAISHA conference last month, and somebody did stand up during one of the other presenters' presentation and talked about something that she had discovered of individuals who were trying to cheat on an oral fluid test. And as she described the method that they were going through, I was thinking, wouldn't it just be easier not to use drugs? I mean, all the hoops that you would have to jump through for the minimal chance that your cheating methods would actually work with oral fluid are very minimal. And the cheating methods wouldn't be worth the effort that you would go through. Oral fluid collections take place right in front of the donor and the administrator of the test. The two are standing side by side or sitting side by side. They're always within each other's eyesight. So they're never going to be apart. There's never going to be an opportunity for somebody to slip something into the sample or to switch samples or any of the other sort of traditional cheating methods that people use with urine testing. They just don't apply with oral fluid, trying to alter a saliva sample, okay? There are thousands, though, thousands of websites that will offer advice on how to cheat on a drug test. But when it comes to oral fluid testing, the best advice they can give you is avoid the test. Avoid submitting a saliva sample, because between these periods of time, as the last one says there, you must avoid being screened or you will surely test positive. That's the best advice the best cheaters in the business can give to somebody who's about to be tested with saliva. Stop using the drug, because you're going to test positive if you don't. And that's one of the big advantages to oral fluid testing. One of the things I think that is drawing a lot of people's attention right now is the fact that drug test cheating is just very, very hard to do. And all of the things that you have to do to sort of combat drug test cheating when it comes to urine collections and putting blue dye in the toilet and turning off the hot water and even observed collections, which obviously very invasive and mandated under certain DOT circumstances. All of those issues, all of those concerns go away when talking about oral fluid testing. It's virtually impossible to cheat on an oral fluid test. I'm not saying impossible, but virtually impossible. And you don't find a lot of information or even really legitimate, hopeful information on the internet when it comes to oral fluid testing. The best advice is stop using drugs long enough before you get, you have to provide your sample, because you're going to test positive. So drug test cheating, an issue that pretty much goes away. Here's just one sample from the Department of Corrections in Iowa from some few years back. They switched from urine testing to oral fluid testing, and obviously the dilute samples disappeared, but the positivity rates, as you'll notice, actually went up with lab-based oral fluid testing compared to their previous lab-based urine testing program. The good news here is that oral fluid testing is legal. It's legal in just about every state. There are only 3 states, Maine, Vermont, and Hawaii, that have issues with oral fluid testing. I've heard even people argue with me that it's legal in Maine and it's legal in Hawaii. I'm not ready to say that yet, because I have written documentation that would contradict that, but I know people that will argue with me on that point. Puerto Rico, obviously, very staunch on that. These are mandatory laws. You can see that there are a lot of states on that map that don't have mandatory drug testing laws. All point-of-care testing devices, some states actually prohibit the use of point-of-collection testing devices, whether they're urine or oral fluid. So this list of states here would not permit POCT oral fluid testing. And then there are some states that would require the POCT device to be FDA cleared. So that becomes another challenge if you're wanting to do POCT oral fluid testing, finding an oral fluid device that has been FDA cleared. These states would require that device to be cleared by the by the Food and Drug Administration. And then there's this whole group of states with voluntary drug testing laws. These are the states that offer, for example, workers' compensation premium discounts to employers that meet the qualifications established by the state, including drug testing procedures. In these states, the ones that are listed here, Alaska, Florida, Mississippi, Ohio, South Dakota, and Tennessee, they do not allow oral fluid testing as part of that voluntary drug testing program. But it's important to note that outside of that program, if you're not participating in that workers' comp discount program, and some companies, of course, can't get into those programs, self-insured companies, for example, et cetera, there are no restrictions on how you do drug testing. Here in Florida, where I live, for example, the voluntary law applies to companies participating in the voluntary program. Outside of it, there is no restriction on doing oral fluid testing, lab-based oral fluid testing in particular, here in Florida. Now, I have an asterisk there, there are some states, Florida and Ohio, which require certain state contractors to have drug testing programs that meet the procedural requirements of the voluntary law. So for some employers, a small number, it does become a mandatory drug testing process. But the vast majority of employers would not have to worry about any restriction on oral fluid testing in these red states if they were not participating in that state's voluntary workers' comp premium discount program. Now, we talked about the Drug Testing Advisory Board and the recommendation to allow lab-based oral fluid testing. That's a big development. I also want to point out, however, right along with that, is that the U.S. Department of Transportation has already signaled that once those guidelines are finalized and there are lab-based oral fluid regulations in place, they will adopt those lab-based oral fluid testings as part of the mandatory guidelines for drug and alcohol testing in the DOT regs. So that's a big development as well. They're waiting like the rest of us to see that happen. There are some people out there who still believe that there are no FDA-cleared oral fluid testing products on the market. That's simply not true. I've kind of covered that already. But again, I want to point out how important it is not only to be using an FDA-cleared collection device for your oral fluid testing, but also that the assays that you're testing in the laboratory are also FDA-cleared. I'm not going to spend a lot of time on this because my co-presenter today, Dan Mayer, is going to touch on some of the real-world situations that he's been involved in working with clients that have actually either switched or set up oral fluid testing programs. But I do want to point out that it's just really not a very difficult process. If you've already cleared any state requirements that apply to your company to drug test in a certain way, you've modified your policy to reflect those with switch to oral fluid testing, then really it's a matter of implementing any type of drug testing program. You determine your collection method, you train your supervisors, you set up your accounts, and basically you're ready to go. It's no more difficult or challenging than any other testing method that's out there. Now, these slides are going to be available to all of you who are on the call today. And this next story I'm going to kind of skip past, so I leave plenty of time for Dan. But this is a really interesting story about a grocery store chain in the Southeast that switched from lab-based urine testing to lab-based oral fluid testing, and they just had some remarkable results. I'm going to just pause on a couple of slides. This one that shows the positivity rate with oral fluid testing being almost twice as high as with urine testing. And if I go back a little bit farther into this, they actually measured the cost of time away from work in different aspects of their business for people participating in drug testing, and they were able to actually save, by converting to oral fluid testing, they were actually able to save over $30,000 in payroll expense just from the first 776 tests that they studied the results of, which would come out to, at the rate of testing that they were doing at the time, would come out to a savings of about $250,000 a year. And again, that comes back to the whole issue about whether or not you're looking at the cost of drug testing as, boom, the $30 or $40 that you're charging or you're being charged for it, versus all the other time that's spent on a drug test, which obviously has to be accounted for from a financial standpoint. Now, I'm real happy right now to be able to turn the microphone, so to speak, the electronic microphone, to my co-presenter today, Dan Mayer from InfoCubic. Dan's got some pretty interesting stuff to share with you, so I'll turn it over to you at this point, Dan.
Thank you, Bill. I'd want to first start off by thanking you for presenting. It's always a real privilege to have an industry expert like Bill present on such an interesting topic these days. As mentioned earlier, InfoCubic is an ISO certified background screening company, and really what the ISO certification means is that we have to monitor, track, and audit pretty much everything we do here. And so part of that process is really having a very strict vetting process when it comes to selecting and maintaining vendors. And it's kind of ironic I'm on this particular webinar with OraSure today because trust me, they had to dispel these very same myths with us as well before we chose to partner with them. And so what we found is they have the similar type of quality, customer support, and responsiveness that we that we expect out of ourselves and that our clients expect from us as well. So we've really enjoyed the partnership with OraSure, and thank them for having us. What I want to talk about today is just a couple real-life scenarios where OraSure's Intercept product has benefited our clients. And so a couple ones here. Location. Obviously, when we first started working with OraSure, we really thought this was only for clients in very remote scenarios, so oil and gas companies, mining companies, that sort of thing. So what we found is these guys have to send and pay an employee to then drive 2, 3, 4 hours down to a collection site and then have them come back. So basically they're spending almost a full day's pay to basically send a person down for a random or a post-accident drug screen. So it's kind of funny, Susan, our rep from OraSure, we're actually implementing a new mining company in Wyoming, and they recently just told us in order to get to the mine and train the supervisors, they literally told us we need to have a 4-wheel drive vehicle to get there, and it's like something like 3 hours past Cheyenne. So obviously being able to do the on-site testing saves them a ton of money, ton of time. Those types, time is money in these industries. The other thing is post-accident. Obviously, after an accident happens, you want to get that collection done as soon as possible so that you don't have the drugs get flushed, further flushed out of the system. So if it ends up being, 4 or 5 hours later after an accident, you may not get the same result. So it's really been a big help for companies with remote locations. A lot of companies may be in a pretty small town where there are no urine drug screen collections. In that case, they have to go to a local clinic or an ER, which can be very expensive. So in terms of convenience, probably our best case study on this is we have a grocery store chain that has 45 different stores and pretty high turnover, pretty high positivity rate for drug screening. So what they were finding with the urine drug screen program is they were spending a lot of time calling us asking where drug screen results were. So they'd call us on a Wednesday or Thursday and say, hey, Joe said he went down on Monday to get his drug screen collected, and I still don't have any results, so I wonder what happened there. So we'd call the lab doesn't have it, call the collection site ends up telling us that basically Joe never took the drug screen. So basically what he was doing is buying some time to flush out whatever he had in his system. So now what you have is not only 4 or 5 days later you don't have a drug screen result for him, you've given him some time to flush out whatever he may have had in there, and then you have the hassle of dealing with a client or a candidate who most likely might have lied to you or fibbed about going to the drug screen collection. So what we've done for them is sent kits to each of their different stores, and it comes with a pre-printed chain of custody form, and we did a nice big group training for all their managers, and now they are able to collect the drug screen right there during the interview process. And so it's really saved an absolute ton of time in terms of chasing down results. Essentially, they know it's done. They know the drug screen has been collected. They know they'll get the results in the next day or two. Another kind of a surprise benefit to that is it's kind of funny, is they had applicants show up and, they'd say, yes, we're a drug-free company, so we're going to drug screen you. And the applicant would show up, no big deal, and, get the chain of custody form, go give a urine test. Well, as soon as they pull out the Intercept product and say we're going to do the oral fluid testing right now, they've had a few candidates who were like, oh, I think I need to go to the restroom here, and all of a sudden that person was gone, skipped town. And so not only did they, basically get pre-screen probably a known drug user, but they didn't really pay anything for it because they didn't even have to use the kit. So I think that was kind of an interesting benefit that we didn't quite expect for that. So it's really saved them a ton of time, a lot of hassle trying to chase down results, and so that's been a great benefit for them. Cost-wise, we have several clients that do on-site, on-site testing, either at a large new hire training session, or they'll do a random pull from some sort of conference or a retraining session that they have their employees go to. And in the past, what they had to do is essentially hire collection technicians to come to wherever they were having the conference or the training session. And so, those folks can cost, $40, $50, $60, $70 an hour. They're going to be there all day. If you have, a couple hundred folks, it can take several different technicians, so it can literally cost thousands of dollars to just pay for the collectors to do it. You have to have certain facilities, bathrooms available and that sort of thing. And then it took all day long. So what you had was, especially for the new hire training, you had the new hires being pulled from the training all day long. So it was disruptive. They might have missed things that they were, trying to be trained on. And really, just the biggest thing was the cost. So now what they've done is we've trained some managers there. So whenever they have these monthly or quarterly training sessions, while they're doing the initial paperwork for that first hour or two of the training, they go ahead and have the oral fluids process done, and they can now finish that in 2-3 hours at most. Didn't pay thousands of dollars, know it's done, and they're not dealing with the distractions of pulling people from the training all day long. So it's really saved them a ton of money, a lot of time, a lot of hassle. Putting together those training sessions is already a big enough headache without having to try and coordinate getting some technicians there to collect. So again, been a very great benefit for them as well in that scenario. The other thing is flexibility. We have a couple fast food chains, and of course fast food restaurants are often, after hours they'll work all night long, serving us tasty food all night. And their issue was really finding collection sites after hours for post-accident. And especially, not every, definitely the standard, Quests and LabCorps, they don't have after-hours collections. So usually you have to go to an ER. If the ER is busy with more pressing issues, you may not get in right away. It's going to cost a lot more to go through an ER. And there's a lot of cases where they just simply didn't have an ER available. So in that case, if any accident occurred, they'd have to wait till the next morning to get it collected. And of course, that again gives more time for whatever drugs they may be on to be flushed out of their system. And what's really helped them with the on-site testing of the Intercept kit is they don't have to send a supervisor down to the ER with the employee. And given that it's an overnight shift, they obviously don't have they only have probably one supervisor or manager working that night. So it didn't disrupt their operations. It it was quick and convenient. You get it done as soon as the accident is done, and so that's really saved them a lot of headache and hassle. And then worst case scenario is an accident happens and they had nowhere to send them. So again, the Intercept product has really helped in that scenario, especially overnight for post-accident. Another issue that, and it's not on here, is to have oral fluid testing as part of your random program is a huge deterrent for employees to not use drugs, basically. I have many clients that do urine random drug screening, and I have many that do oral fluid. And the oral fluid folks, those employees know that if their name gets called, they have no chance to adulterate the sample. That's going to be their last day working there. So what we've seen is that it's just a huge deterrent, because folks with the urine drug screen program, they know they can go somewhere and grab whatever adulterant they can find. I literally had a client tell me that one of his guys said when he got randomly selected, he told him, "Well, I tell you what, boss, if you go down with me to the collection site, I'm going to fail. But if you let me to go by myself, I'm going to pass." So basically, obviously tipping off that he was going to go do something to mask his samples. So I tell you what, when you introduce an Intercept random drug screening program, folks know they better not be using drugs or they're going to be caught. So I think that's several good case studies on why it's been a great benefit to us and our clients. And so I think from there, I will turn it back over to Bill.
Hey, Dan, that's great information. Let me ask you a couple of questions that came to mind as you were describing some of these situations. When a company converts from a urine testing program to a lab-based oral fluid testing program, how long does it take from the moment they say, yeah, I'm ready to do this, until they can be up and running with their oral fluid testing program?
The legwork on the back end is really pretty simple for us to get rolling. To me, it really came down to the policy. So it was a matter of how quickly they could revise their policy to add the oral fluids portion to their existing drug screening policy. And a lot of times, it is best to notify employees of the change in policy. So really, whatever time frame it takes to get that policy done, what we're doing in the background is now getting them the kits. And the kits come with everything you need. It has the chain of custody form, has the FedEx form to ship it. So it's everything in one package. And then in the meantime, so we'll go, and it's great. Susan, our rep from OraSure, is awesome. She will join us in visiting that client and getting their managers trained on it. So really, once that policy's been put in place, they can go from day one as soon as that policy is in place. So it's been, absolutely seamless in every implementation we've done because we can do all that legwork while they work on that policy, which is really the only part on their end they need to do.
Now, I know you can't talk about specific prices because there are a lot of factors that influence the price of a drug test, but are people generally surprised or pleased with the price of oral fluid testing being comparable to urine testing? What's been your experience with clients that have adopted oral fluid?
Yeah, that's a great question. That's another myth OraSure had to dispel with us. I thought it was expensive. I thought it was on par with hair testing, which can be pretty steep. Every client that's used it is surprised. It's essentially the same cost as urine drug screening. Depending on their volume, there's cases where it'll be even more affordable than urine drug screening. So I've yet to charge a client more for urine drug screen or oral fluids than a urine drug screen.
Now, are you dealing with any companies yet that have decided to merge two different technologies together? In other words, they're doing oral fluid testing, but they're also doing urine or hair testing. Have you seen much of that yet?
Yes, actually, the fast food chain does still do the urine drug screen for their pre-employment screening, and then they've chosen to use the oral fluids for the post-accident. Again, it's quicker. They don't have to pull a manager off site to get it done, and then the after-hours issue as well. We've seen that there, and then we have seen some. The couple of the mining clients we've had has also done that where. The interviewing's being done at a corporate office in a metro area, so that's, they can send the person to a local clinic or collection site for the urine drug screening. But then once they become an employee, they're up in the middle of, in the middle of North Dakota somewhere, Alaska somewhere, Canada somewhere, and so the urine drug screening collection no longer becomes viable. So that's when they switch over to the oral fluids for the random and post-accident testing.
Okay. And then one other question, and this is something I get asked a lot of, so I'll answer the first part of it, but I want to ask you part of it. I always get asked, is oral fluid testing not just legal in a state, but is it legal for all types of testing? In other words, I want to do pre-employment and post-accident and reasonable suspicion and random testing with oral fluid, and so is that legal to do? And, of course, the answer is if oral fluid testing is legal in a state, then it's legal for every testing situation. Do you ever run into situations like that where there's any confusion about that, and how do you sort of dispel that myth that somehow oral fluid testing is sort of segregated from other types of testing when it comes to whether it's legal for random versus pre-employment?
Yeah, that's a great question. We do get asked that, and I would certainly direct them to an expert like you, Bill. I know you have a great website that speaks to that a lot. We also work very closely with OraSure. They're awesome, very responsive in terms of making sure that we keep our clients compliant in terms of any of that sort of thing. But as you said, if it's legal in the state to do it at all, then it's legal to do it for all types of testing. Really, the key there is to have a good, strong policy in place. And that's really the key to any sort of good, solid drug screening policy, whether you're using urine, hair, or saliva. It really comes down to having a strong policy. And, of course, we can't provide legal advice, but we're always happy to, provide some guidance in that area. But to me, it really just comes down to having a real solid policy in place. And then, as you mentioned, as long as it's legal in the state, you can use it as you see fit.
Now, I thought it was interesting in your part of the presentation, Dan. You talked about an oil and gas company. You talked about a grocery store chain. You talked about a fast food establishment. And I have found over the years that oral fluid testing is a real good match with certain industries. And I list some of the ones here that I've dealt with in terms of developing policies or revising policies in the workplace market. You can see at the bottom, obviously, other drug testing markets use oral fluid testing as well. But you pretty much, you from your examples, you hit on all of these, and we didn't even coordinate that. I think that's interesting. Have there been any other industries or clients from other industries that have shown an interest in oral fluid testing as well?
Well, I tell you what, I was surprised as well. When we were first approached by OraSure and really first started marketing it, we thought, man, this is really only for folks out in the middle of nowhere. You know, your oil and gas and mining and that sort of thing. And then, you know, we did a couple campaigns, and especially to our existing client base, which is very wide. You know, I mean, we have every kind of industry you can think of. We were surprised at the response, and it is, you know, it's right down to, you know, you mentioned staffing, hospitality, manufacturing. We were pleasantly surprised at how broad a base that, you know, the industry, everybody could use it, and really once it's really dispelling these myths that help do that. And what we found, I mean, it's very similar to background checks. If you give a person a release form and say, I'm going to do a background check on you, well, if they have a bunch of stuff they don't want you to know about, you're never going to hear from that person again. It's very similar with drug screening, especially with the oral fluid product. If they know they use drugs, they know they can't fake this oral fluid testing. So you won't see those guys again either. So you're going to screen out folks right away. The other thing is we found in this industry is, you know, you become, if you don't have a background check program or a drug screen program in place, you become a magnet for criminals or drug users. You know, drug users tend to do drugs with other drug users. So if they get hired on and say, hey, you know, this company doesn't do drug screening, they say, you know, you should apply. Next thing you know, you're going to have a workforce full of drug users. You know, very similar to background checks. If you know, criminals tend to run in packs as well. If you're not doing background screening, your company can become a magnet for criminals. And to me, so if you have a good background check policy in place and oral fluid testing in place, you know, it's going to quickly become known. Don't even bother. Don't even bother applying. So I found that to be an interesting benefit to this, and that's across every industry we work with.
Let me ask you a practical question. Obviously, with lab-based oral fluid testing and POCT oral fluid testing for that matter, one of the advantages is being able to use your own employees, trained of course, to administer the test, administer the collection. And I think that probably would be a concern either to some employers or some people in the drug testing industry of being able to turn over that really important, critical, sensitive part of the drug test process to an employee. Yet it's one of the advantages, not to disparage professional collectors, obviously, because they play a very critical role in the drug testing industry. But for employers that find themselves in a situation where the collection is either at the least inconvenient, if not impractical and overly expensive, what would you say to somebody who has the concern that, you know, you're turning this over to an employee? Isn't it possible that they'll do something to cheat on the collection process to provide some cover for a friend in the company that they know is using drugs? How would you address that concern?
Well, I'd say first and foremost, and it's definitely something we've heard before, you know, we will provide along with OraSure, and OraSure is just amazing about how they do this for us. You know, they'll send someone down to the client's location and do the training with us. They have webinars they can do. They have online training sessions. They offer you know, guides you can see. So they really help us make sure that the employees that are in charge of doing this are well trained in doing it. They're you know, very aware of the process. To your point, to, you know, maybe someone's covering for a fellow employee or whatever, you know, you can have two folks on the chain of custody that witness it. And the nice thing about it is, I mean, the employee themselves handles the device, so and basically administers it to themselves. So there's no real transfer of custody of the of the test itself or the kit. So it's really it's something we've run into, but I think with the proper training and the proper guidance, we've really been able to alleviate that issue, and have really never come into any sort of issues where that's become a problem with someone helping to fudge a result or anything along those lines.
Recently, we have a LinkedIn group called State Drug Testing Laws, and we posed the question to the group, how big is the problem of drug test cheating, and can you share some examples? And we posted an article, a link to an article on our website in our last newsletter, State Drug Testing Laws Monthly, with all of those different responses we got. But one of the things I was really surprised about, Dan, was that there were people who responded to the question by estimating that the problem of drug test cheating is much, much higher than we probably think it is. I usually tell people, 1% to 2%, somewhere in that range. But there were people that were telling us through the LinkedIn group discussion that it's much, much higher, 10%, and in some situations higher than that. Obviously, oral fluid testing addresses that issue of drug test cheating. I mean, are you aware of any situations where somebody has sort of successfully switched a saliva sample with somebody else's saliva, or that they've put the collection device in somebody else's mouth rather than their own mouth and somehow gotten away with that?
No, we have not had any sort of circumstance like that. And it's funny you should mention how many people do the try and cheat. Our website, we're pretty highly ranked for many keywords on Google and all that good stuff. And of course, we do web analytics, so we track how people get to our website. By far, the most keywords people use to get to our website is how to cheat a drug screen. And it just so happens that we have a pretty robust drug screen page, so it ends up getting to us somehow. And of course, we're not, on our website, we're not telling people how to cheat or anything like that. But it's staggering how many people Google that, compared to, checking out background checks and stuff. So I think it's definitely more prevalent than people think. And again, I think an issue is drug users, do drugs with other drug users. So once one guy figures out how to mask their urine sample, they're telling all their friends. And if you do go online, there's plenty of ways to go about doing it with urine. We have yet to hear anything with any sort of adulteration with the saliva testing. I think OraSure will tell you. Basically, the other issue is, we have people that, they go down to the collection site and they can't give a sample. They sit there for 3 hours and just, can't give a urine sample. Well, with saliva, if you don't have saliva, you're dead, basically. So there's really no way to not give a sample. So that's another aspect of oral fluid testing that is I think pretty good. We get a lot of folks that, I was down there for 5 hours and I couldn't test. Well, they're buying time is what they're doing. So you can't do that with oral fluid testing. So again, you can't fool it. We've yet to hear anyone even try or get away with it or anything along those lines.
Thank you, Dan. I appreciate that. Great responses. Good questions from our audience that I've sprinkled into the discussion, and great responses. Thank you. We're just about out of time. I do want to just sort of review real quickly the advantages to lab-based oral fluid testing. I've got them up on the screen right now. We've talked about all of these, but it really goes back to those 3 questions that I presented right at the beginning. Is it accurate? Is it legal? And is it practical? Will it work for you? Will it work for your company? And again, people who know me, and I've been in the drug testing industry a long time. I present at SAP and DAISHA every year, and DAISHA many years, most of the time. And I'm a proponent of drug testing. I mean, I don't make any bones about that. And I think every drug testing method has merit. And under certain circumstances, one testing method might meet the needs of a company better than another testing method. I think with the coming regulations for lab-based oral fluid testing, I think it's a good time, a smart time to look at it, either as an alternative to what you're doing or as an addition to what you're doing. As Dan talked about earlier, having oral fluid testing for recent use situations like post-accident and reasonable suspicion, and hair testing as a pre-employment screen, or using oral fluid testing as a random testing method, and urine testing for pre-employment, or some other combination thereof. There are a lot of advantages to looking at oral fluid testing as an add-on to what you're doing, or in some situations, depending on your circumstances and the cost that you're incurring with drug testing and the practical aspect of getting drug tests actually done, it may be a replacement for what you're currently doing. There are a lot of advantages that stack up very well in comparison to other drug testing methods. Again, this coming from somebody, myself, who's a proponent of all drug testing methods. I think this just works for some people in certain circumstances in a way that maybe is better than other methods. So with that, that's our presentation from Dan and myself. We want to again thank OraSure Technologies for providing these monthly webinars and for the opportunity to make this presentation. If you would like more information, you can certainly contact OraSure Technologies or InfoCubic, and you'll find a wealth of information about lab-based oral fluid testing to answer any questions that you might have. And with that, I turn it back over to Jessica.
Thank you, Bill and Dan. On behalf of OraSure Technologies Incorporated, we hope you have found today's presentation informative and helpful. This presentation was recorded, and you will receive instructions informing you how to access the recording. Today's presentation is approved for 1 credit hour of continuing education for CSAPAs, CDAPAs, and QSAPs from SAPAC. Please use the unique identifier 0178-1305-OraSure in association for that credit. Again, that number was 0178-1305-OraSure. And if you have any questions about that, I will stay on the line for the next couple minutes if you need that number again, or that identifier, excuse me, again. Thank you for your attendance today. This concludes today's webinar. Have a great day.